Minerals. Minerals are essential to functions. They build bony tissue, soft tissue, hair, nails and skin, and the blood. Minerals regulate body fluid pressure, muscle contraction and relaxation, nerve responses, blood clotting, oxidation, and acid balance. The classification of minerals. There are major elements and trace elements. The major elements are found in greater than 5 grams in the body. The RDA says they have to be at least 100 milligrams. Some examples of major minerals would be calcium, chloride, potassium, sodium, magnesium, phosphorus, and sulfur. The trace minerals. These have amounts less than 5 grams in the body. The RDA recommends less than 100 milligrams. Some examples of trace minerals are copper, selenium, iron, iodine, fluorine, and zinc. Harmful minerals are found in lead, arsenic, and mercury. The larger the fish, the more pollutants would be found in that fish. So eat just a few times a month, some of the larger fish like sharks, pike, albacore, and halibut. Eat a few times a week trout and canned tuna, and unlimited supplies of salmon, pollock, oysters, and krill. Major minerals. Calcium, the most abundant in the body. 99% are found in the teeth and skeleton. Their function is to build and maintain bone and tooth structures, blood clotting, muscle movement, and to transmit nerve impulses. Some calcium sources include dairy foods, sardines, oysters, salmon with bones, dark green leafy vegetables, and citrus fruits. Dried peas and beans. Requires adequate amounts of vitamin D in the diet for it to be absorbed. A calcium deficiency results in osteoporosis. The body does not absorb all the calcium that is consumed. Sometimes calcium supplements are required. A calcium deficiency could result in rickets, or osteoporosis, where the body withdraws calcium from the bones if not enough is eaten and absorbed. This X-ray shows the results of rickets, or a bowing of the long bones of the legs. Phosphorus. Its function is to help build bones and teeth, help release energy from carbohydrates, fats, and proteins, aids in formation of genetic material, cell membranes, and many enzymes. Some sources of phosphorus include meat, poultry, fish, eggs, dried peas and beans, milk, and milk products. Deficiencies are rare because it is easy to find phosphorus in many foods. The prolonged use of antacids can lower phosphorus amounts. The ADA recommends 800 milligrams in adult males and females. Sulfur. It's the third most abundant in the body after calcium and phosphorus. Sulfur's function is for healing and cellular respiration. The sources include protein, rich foods such as meat, poultry, fish, and egg yolks, kale, cranberries, onions, and garlic. Sulfur deficiencies result in arthritis, skin disorders, and hair loss. The RDA has none listed since people seem to get enough from a normal, healthy diet. Magnesium. Function is for bone growth, manufacture of proteins, release of energy from muscle glycogen, conduction of nerve impulses to muscles. Some of the sources for magnesium include raw leafy vegetables, nuts, soybeans, seeds, whole grains, and cocoa. Deficiency can lead to tremors or muscle twitching, muscle weakness, or leg cramps. The RDA recommends 350 milligrams in males, 280 milligrams in females. Potassium. Its function is for muscle contraction, maintain fluid balance within the cells, transmission of nerve impulses, and releases energy from carbs, proteins, and fats. Some sources of potassium are orange juice, bananas, fresh fruit, meats and bran, peanut butter, dried beans and peas, coffee, tea, and cocoa. Potassium deficiencies lead to dehydration from medications, especially diuretics. It can lower the blood pressure. RDA requirements a minimum of 1,600 to 2,000 milligrams daily. Probably more is needed. Sodium. Its function, with chloride, regulates the balance of water in the body, regulates nerves and muscles. Some sources of sodium are table salt and prepared foods. A sodium deficiency is caused by heavy and persistent sweating, chronic diarrhea, or renal disease. Chloride. Chloride functions to maintain the acid, base, and fluid balance in the body, part of stomach acid. Main source is from table salt, and deficiencies are rarely seen but could be caused by dehydration. The trace minerals. The trace minerals include iron, whose function is for hemoglobin in red blood cells. Myoglobin in muscles provides the oxygen in cells. Sources include liver, kidney, red meats, egg yolk, dried fruit, molasses, and green leafy vegetables. A deficiency leads to anemia. Some signs and symptoms of anemia are pallor, fatigue, low energy, and headaches. Coffee and tea can also lower absorption. Glossitis, chelosis, gray mucous membranes. The RDA recommends 10 milligrams daily for males and 15 milligrams daily for females. Zinc. Zinc's function is for cell growth, healing, and the immune system. Sources include meat, liver, eggs, poultry, whole grain cereals, nuts, and legumes. Deficiencies delay wound healing, skin lesions, loss of taste sensation, loss of appetite, lowered immune system, and in children, the failure to grow and mature sexually. Prenatally, abnormal brain development. The RDA recommends 15 milligrams for males and 12 milligrams for females. Fluoride and fluorine. Its function is to produce strong, decay-resistant teeth. Sources of fluoride and fluorine, it's found naturally occurring in water. Too much can cause fluorosis or mottled enamel and poisoning. The RDA recommends 1.5 to 4 milligrams daily for adults. Iodine. Its function is to regulate body metabolism. Good sources of iodine are eggs, seafood, kelp, and iodized table salt. Deficiencies result in hypothyroidism, leading to goiters and mental retardation. The RDA recommends 150 micrograms. Copper. Its function is for energy production, connective tissue formation, and for the central nervous system. Sources of copper include shellfish, whole grains, dark leafy vegetables, nuts, legumes, and chocolate. Deficiencies result in anemia and osteoporosis. The RDA recommends 900 mcgs or micrograms.